disease. And the way I usually explain this is an analogy through imagining a sort of army inside your body that's taking care of stresses that come in. And stresses could be in the form of air pollution, pesticides in food, heavy metals. It can be structural misalignment. It can be nutrient deficiencies, toxins in our skincare, toxins in our home environment. There are many sort of micro wars that are happening on a daily basis because our bodies, I think a lot of people have this idea that we're this self-contained vessel that's really separate to the environment, but we're very much a part of the environment, and we're always exchanging, even with every breath, we're kind of exchanging with our environment. So as these toxins or stresses come in contact with our body, the army, let's say, has to go there and fight against that stressor as it comes in. So what happens when we're overburdened with stress or toxins is that the army is very diluted, or it's weakened by having to fight all of these micro wars around. And then when something like COVID or a virus comes in, it's really difficult for the army to actually take action because it's already weakened and it's already diverted across many different aspects. So the idea really is to kind of remove those stresses on the body so that the body can do its natural job, which is healing, which it's trying to do all the time anyway. But we can really help it along by just identifying and removing. So, when you say things like, okay, there's try to clean up your skincare routine because women use, I think, 12 to 14 products and men use around 6 products, and they're full of different fragrances and parabens. And it might seem like, how could this possibly affect? But, accumulated with all of these other things that I'm talking about, the impact can be really big over a period of time.
So I just want to jump in here, and because I know people are going to be thinking this, and they've asked you and they ask me about this. So like people have been, living a particular lifestyle for like decades, right? Somebody's in their 30s or 40s or 60s, and they've been healthy their whole life. They've felt great. Maybe they're slowing down a little bit, in the last couple of years or last few decades, but overall they're doing well. And maybe they're eating junk food, or maybe they're sleeping whenever they want, and they're using whatever skincare products they want. And then they get COVID, and then they develop long COVID, and then you or I tell them that, hey, you have to like overhaul your lifestyle, right? And they're like, well, that doesn't make any sense because I was fine until COVID. Don't I just have to get rid of COVID? Like, don't I just need to do something to get rid of the spike protein or the virus? Like, why do I need to change everything when I was doing fine?
Mm-hmm. Yeah, I think, well, there's many answers to this, but I think one thing that's quite interesting, and this is one thing that we do in the coaching program, is different symptom mapping, because I think a lot of times people normalize symptoms. And when I say symptom, it could be something like, a white spots on your fingernails, which could indicate a zinc deficiency, or it could be dry hair, or it could be bloating, or it could be fatigue after meals. Or it could be, heartburn. Like it's so often the case that I speak to people and they say, yeah, I felt completely fine before COVID, but I've just been taking antacids for the last 10 years. And it's like, okay, well, there's something wrong here. It's just that this hyper normalization of, seemingly micro symptoms is quite insidious, because it gives us the impression that everything is fine when it's not. And I think the opportunity to kind of do symptom mapping and understand what's really going on in the body is a kind of an access point to this exploration.
Right. I think that, so the question is, maybe I'll rephrase it, right? Like, well, that was good enough for me, right? Can I just get back to that by just like popping a pill and, maybe the spike protein will disappear? I mean, the problem with that is that, like, okay, so a lot of times, you take something for, long COVID specifically, and for some people it works, and really they don't need anything else. But then there's a lot of people also that take something for long COVID and it doesn't work, or it works partially, and they're still not rid of the symptoms. But I think like what they're thinking is that, like, why do I have to change all these things when I just want to get back to what I was before I got COVID, right? Or before I developed MS, or before I developed inflammatory bowel disease, or before I developed, this new chronic illness, right? There was a period of time where I had the same exact lifestyle I have now, and I was fine. And then something happened, right? Like maybe, like it's different. Sometimes you'll take do an intake with somebody, like a functional medicine kind of intake, like a broader intake than is normally done in conventional medicine, and you'll be able to identify like a trigger, right? Like I got sick, or I came down with the flu, or something happened, or I got pneumonia, or or I like lost my job, or I got divorced, or like some terrible stressor happened, somebody died, and I was never the same again, right? And so they're like, why do I have to change the lifestyle that was working before, after that particular event, whatever it was that may have triggered this, or maybe there's no event that they can identify. It's just like, like you were saying, like maybe their health is like they weren't really noticing it, like little minor things, micro symptoms, as you said, developing over decades, but it wasn't really like enough to like bother somebody, right? It's like, well, I can just take something to suppress this symptom, and I still go on with my life. I feel fine. I'm still able to work. I still, have good, energy, and stuff like that. But then, kind of suddenly it shifts and it becomes like, unmanageable. And it's like, now I'm really bothered by like terrible symptoms and new symptoms, right? So I think that's where the disconnect is like, why do I have to change everything when it seemed like, I was fine before? Why can't I go back to being fine with that old lifestyle that I used to have? Why do I have to change the lifestyle? And like, more than like, why do I have to change it? But like, how does it make sense that I was able to tolerate that lifestyle before, right? And now you're telling me I have to change all those things I was doing in order to get back to quote unquote normal for me, or maybe better than normal, but to reverse the chronic disease. Like how, like why would the chronic disease go away from lifestyle if it wasn't there because of lifestyle before I got it? You know what I mean? Right? Like it's like a two-way street, right? Like if the lifestyle has some causal connection to this chronic illness, right? If I change life, if I move lifestyle levers, if I fix different things in my lifestyle, you're telling me that my chronic disease may or will get better, right? And may even resolve completely. But like, if there's that causal connection, why didn't I have the chronic disease this entire time, right? Since the day I was born, or since I was 10 or whatever, right? Like kind of when my lifestyle kind of like solidified, or in my 20s, right? Like, why did it take so long to develop the chronic disease?
Yeah, I mean, I think it's the case with many viruses, not just COVID, that it kind of triggers a continued inflammatory response in the body, kind of almost like a autoimmune. Well, people are saying now that it's likened to autoimmune conditions. So your body's, rid of the disease, but the inflammation just continues in the body. So that kind of circles back to what I was saying at the beginning about, your body's in some kind of war against this inflammation, and you just need to make sure that all of the energy is going there to that thing, because that thing is so big. So then it's minimizing all of the other wars that are happening with all of these other things that we're talking about, the pollution, the microplastics, the skincare. So yeah, it's just about removing the barriers to healing. I think in a broader sense, that's the idea. Of, I mean, to explain why these conditions, why whatever was happening before wasn't affecting you, and now it is. And the other thing I think maybe to say on that is, COVID came along at this specific time, but, it's often the case that people then get to their 60s or 70s and they have cancer or metabolic syndrome or diabetes or dementia. Like all of the statistics on these conditions are growing so much every year, and it's a result of this basically. So in some ways it's, if you can jump on board this early, it's a good thing before you reach 70 and have dementia or something like that. So yeah, I think those two things are important.
Right. So I'm like kind of the way that, another way to like put it is that what we learn in like biology or in like physiology is that there's something called homeostasis in the body, where your body tries to maintain certain like levels of different things and certain, like a balance basically is what it is. It's like, it's a balance. And so your blood aims to maintain a certain level of sodium in it, within a small tight range and a certain pH. And so like all natural systems have this balance, right? Like the environment around us. And, you can change the inputs a lot and without changing the outcome. So like, things like the system will maintain a healthy balance and continue to work normally, even when you like dramatically change the inputs up to a certain point, right? Like it has a certain ability to absorb, for example, unhealthy behaviors. But if those unhealthy behaviors or inputs are changed like too much, obviously if you suddenly stop eating and drinking, like you will die, even though you can go for a while, right, without taking in food. Like many people can go for like months and months without eating, without drinking, right? Like your resilience, to lack of water is far less than your resilience to lack of food. And, it's probably counted in weeks, a week or two, three, maybe, that people can go without water. And obviously, like your ability to go without oxygen is far less than your ability to go without water. But there are things that, people are born healthy and they can live an unhealthy lifestyle for a long time before it overwhelms their body's kind of homeostatic mechanisms, the things that are kind of keeping everything in place. And so I think that's one way of looking at it, that, people, like you said, they have all these kind of like quote unquote wars going on inside them, all this inflammation, and their body's fighting it off and able to make you still feel like you're pretty normal, right? Like it's all kind of happening in the background, right? You're not really consciously aware of it. Most people are not consciously aware of it. Some people are, aware of some of the things. But it's not like a terrible chronic disease. But at some point, even if there's not a trigger, right? Like what you're saying is like, even if you don't catch something like COVID or, develop like if there's not some kind of like trigger that turns it into a specific disease, that kind of like ongoing stress on your body eventually breaks down the systems, and some kind of chronic disease is developing in like vast numbers of people in our society today. So, dementia and heart disease and, strokes and diabetes and, obesity and, all these kind of conditions are developing in people. The vast majority of people who have, basically the Western industrial lifestyle, right, that so many of us have, that basically leads to chronic disease. And the reason we know that it's lifestyle doing that is because if you roll the clock back like 100 years or 200 years, or if like I think a good example is if you go and look at people who were healthy for generations in Okinawa, Japan, and then, they move, to the US. Within one generation, they have all the diseases that we have in the US, right? They have the high blood pressure and the heart disease and, the dementia and the strokes and everything. So like the only thing that's changed in one generation is their environment, right? Their genetic code has not changed in one generation. So you take like their parents are living to like 120 and like running up the mountain, and then, their kids come here and, within one generation, you've got, all this chronic disease and you're dying in your 80s or 70s or whatever. And you're basically at the same level of health as a population as the population that is in the US. So I think that's one of the things that tell people that it's lifestyle that creates chronic disease. But I think also still there's this, there still might be a disconnect of like, okay, well, I get that, right? Like, yeah, if I live a, unhealthy lifestyle, if I drink and smoke and, don't sleep well and whatever, then I'm going to end up with, probably, I'm at a higher chance of ending up with high blood pressure and, maybe a cancer or something in my 60s or 70s and all that stuff. But then it's like, Well, that's one thing, right? Like I know that, right? Everyone kind of knows that. Could be in their future if they continue the way they're going. But it's like far enough in the future that it's like, I'll deal with it later, maybe, right? Or maybe I'll be one of the people who it doesn't hit them, right? Like I'll be the exception to the rule. I'll be the, the 95-year-old who smoked his whole life and drank every day, and nothing affected him. Everything bounced off of him. But I think a lot of people feel like, okay, like if I develop a specific illness suddenly, like in my 40s or 50s, just seemingly out of nowhere, that's something different. That's like a different problem. And I think what you're saying is that it's not completely different. Maybe it's somewhat different because there might be a specific issue that is kind of like tipping the scale in a specific area and, causing specific disease, like long COVID, for example. There's a specific type of inflammation, perhaps triggered by the spike protein, that develops a specific, symptom, set of symptoms. But if we look at the body as a whole and kind of like think of it as you're saying, that it's dealing with a lot of stuff and it's not able to deal with the long COVID as it should. So like normally, if we understand long COVID as like in this paradigm, that perhaps it's the spike protein is kicking up a specific form of inflammation in the body, or specific, avenues of inflammation, and those are causing specific symptoms. For most people who get COVID, or at least a large, a large percentage of people who get COVID, they don't develop long COVID, right? Some people do, some people don't, and we're not really able to predict who's going to develop it and who won't. I mean, we see very healthy people develop long COVID, and very unhealthy people don't develop it sometimes. But for whatever reason, the person who doesn't develop it, their body's able to get rid of the spike protein. It's able to rally enough, forces in the immune system to clear it out, right, and to stop the inflammation and solve the problem before it turns into long COVID. And other people, in other people's bodies, for some reason, they are not able to get rid of it. And I guess what you're saying is that in those people, if you can remove enough of the work your body's doing against all this other stuff that it's dealing with all the time, all the other stresses that are, being imposed upon it in terms of lifestyle issues, then your body will be able to free up enough resources to focus on the long COVID problem and help you get over it. Is that right?
Yeah, I think that is the idea. And actually, it's interesting you said this about the homeostasis, because it reminded me of an interesting study I read some time ago that related to a drug that was being developed, but I forgot what it was for. But basically, the concern was that it would change the calcium levels in your blood, and then that would affect the pH of your blood. So this was already a concern. And when the drug was going into trial, they were testing people's blood, and the pH was fine, everything was good. The drug was launched, and then a few years later, a lot of the people who were taking it got osteoporosis and started having these bone issues. And they realized what was happening was that the body was stripping calcium from the bones to use to maintain this pH level in the blood. And really, that's the extent our body will go to try to be in homeostasis. It will strip your bones to make them more brittle, just to keep a more important, because different processes have different hierarchies in terms of keeping us alive, and the pH is really important. So the body has this way of deciding, okay, this is really important, the bones are less important, let's strip this mineral and use it for this. And the way that we see things in science is very reductionist, and we just think, okay, well, it's going to affect this one thing, let's check up on this thing, everything's good, and then you realize later it's not. So your body's really working super hard to keep this balance all the time. And that's why I think people can get away with not being so healthy for a long time before something comes in. But it's not, I mean, I'm from Zimbabwe, and there's a lot more, let's say, serious diseases there, like malaria. And when people get malaria, which is really common, you get this kind of thing, like relapses every time you're a bit tired or run down, like you have a re-flare of malaria symptoms. So any kind of, chronic, not chronic, any kind of intense, attack on the body can cause these kind of continued reactions. And that is very different to, you know, Alzheimer's or dementia, which kind of are insidious in the sense that they grow in these tiny increments over years and years.
Yeah, I think there's a difference in terms of, there are some pathogens or illnesses that really gain a really strong foothold, a really deep and strong foothold in the body, and we don't yet know how to get rid of them, right? Like completely remove them from your body. They're just like stuck in there really deep and wedged in really tight. And in those cases, people are able to manage them, right? If they clean up their lifestyle enough, they're able to like suppress the symptoms almost all the time, if not all the time in some cases, right? That's what we see in lifestyle medicine. And then there's other things which are entirely lifestyle. So I'm glad we kind of like made the differentiation here, right? Like, so things like, those things that develop in the 60s, 70s, 80s, those are almost always entirely lifestyle. Like in some cases they can be due to like one like overwhelming like issue, like a toxin, like a mercury poisoning or something, so you can have like dementia triggered by a specific thing like a pesticide, or you can have dementia triggered by like 100 things, right? And usually it's like 100 things, right? And one of them might be the pesticide. That might be kind of like the prominent one, but and again, there might be more prominent causes, but there all of these diseases, when you read a textbook of medicine, they just say like the cause is multifactorial, which means there's multiple factors. And even though we know that, we're like science, the way it's like built from the ground up, we're always looking for like the one drug that will help us defeat dementia, Alzheimer's dementia. And we never find it because that's the wrong approach. You can't like hope to find one drug that does 100 different things. So this reminds me of Dale Bredesen. He had been studying Alzheimer's as a research scientist for decades, and his wife was a functional medicine doctor. And so the functional medicine physicians, they approach things from this perspective that, okay, if it's multifactorial, we got to address all the different factors, which is a lot of lifestyle changes, plus maybe some targeted supplementation to like boost something that you may be genetically incapable of absorbing or handling yourself, but targeting all the multiple factors. And so one day he basically was like, I guess something shifted in his mind. He was like, you know what, why don't we try this? And so he kind of listed all the different things from his decades of experience studying Alzheimer's disease. Like he made a list of all the different things that need to be fixed, right? And or that can contribute, right? So like, for example, low B12 we know can itself cause dementia-like symptoms. But if it can do it itself when it's severely low enough in some people, why wouldn't like a somewhat low level, right? Like a less than optimal level be a contributing factor for, the vast majority of people who don't have one specific thing causing it, one specific like severe imbalance triggering their dementia. A slightly low B12 might be, even though if you just correct the B12, you're going to see no difference in the dementia. But if you have like slightly off parameters across 100 parameters and you just fix one of those slightly off things, you're not going to see a beneficial outcome. But if you fix all 100, right, or maybe just 70 or 50, then you're going to see a change. So he wrote a book called The End of Alzheimer's, and he developed kind of like a personalized medicine protocol, which is now been studied. Actually, he recently published a paper, I think half a dozen people or a dozen people, that they basically created a personalized program that like it's a protocol. So like in one sense the protocol is universal, but in another sense it really depends on the inputs to the protocol. So you check somebody's B12, and if they're normal, you don't do anything in that particular case. But the next person comes along, in the study, they have a low B12. You got to give them B12, right? So some people might be getting B12, some people might not be. Some people, and that's just like one part of it, right? Like he's checking a lot of things. He's looking for chronic infections and mold toxicity, and optimizing your vitamin D level, and telling you maybe you need to get out in the sun a little bit, maybe you need to exercise a little bit, maybe you need to lose weight, so you're trying to correct all the different things, all the multiple factors, which everyone agrees, feed into this illness. But in the textbook, right, you just kind of leave it vague, right? And just try and just talk about specific drugs that may have like minimal benefits for things like Alzheimer's disease, or you're trying to treat symptoms like with diabetes. You're just trying to like force the blood sugar to go down, right? Which is possible. Or with high blood pressure, you're just trying to force the blood pressure to go down, and it's like you're not addressing the root cause. Same with like high cholesterol. You're trying to force the cholesterol to go down, and it's like cholesterol goes up for some other reason, right? Cholesterol itself is not the problem, right? Just like the high blood pressure is not the problem. It's like the body's sending you a message. It's saying that like, I'm doing this because there's something like way off, right? And this is my reaction to that thing that's way off, or multiple things that are way off. And we're not listening to the message. So I think this gets to something that we've talked about before, that like people are kind of like unconscious. It's like they don't have the headspace, I guess, to sit with themselves anymore and like be aware of what's going on in their bodies, right? Like I eat something and I feel great, I feel fantastic, and I eat something else and I feel terrible, right? Like we're not making the connections anymore, right? It's like we are, I mean, like what is it in your, like from your perspective? I mean, is it, why are we so distracted from ourselves?
Yeah, I think there are so many reasons, but one thing that you touched on before was, about isolating things. I think I follow a lot of food scientists and also cosmetic scientists, just out of interest of, what they talk about. And it's interesting because they always say, oh, well, this skincare product is fine because there's this study to show that actually parabens are completely safe, and, it's this and this. And it's just really, and people say, and then people take that at face value and they think, oh, parabens are fine because of this. And it's that, this study is not done in combination with, air pollution and pesticides and some prescription drugs and maybe an underlying condition like an autoimmune condition. It's the compounded effect of these that makes them not good. And if you just take one of these micro things, and like you said, if you take B12, it's probably not going to cure the person's dementia, but that doesn't mean that it's unrelated to it. So this is the thing with scientific research, and especially in this realm. I mean, I've been focused on this a little bit recently, just in the skincare realm, and how crazy it is that we're being told that these things are completely safe and fine because it shows it on a study. This is not the reality of most humans who are having this compounded with hundreds of other chemicals on them every single day.
Yeah,
So
that's such a great like point, right? Like I never thought of it from that perspective, right? For like the negative factors, like I've only thought about it in terms of like positive factors, right? That like you have to change a lot of positive things in order to have a positive outcome. But like what you're saying is like from the other point of view, that like just one negative thing. I mean, that's such a great point. I never really looked at it like that. That like one negative thing, may not tip the balance for you, or it may not be like the straw that breaks the camel's back, right? Like you can throw millions of straws onto the camel's back before he suddenly collapses, unable to hold them.
Yeah, like one example of that is I always see sodium lauryl sulfate, which is kind of something that causes the foam, in shampoo and toothpaste and things. And because I had this dermatitis kind of predisposition, I stopped the sodium lauryl sulfate toothpaste, and it helped a lot. But then, I'm always seeing food scientists say, debunked, sodium lauryl sulfate is completely fine. All the studies say it doesn't do anything. Like if anything, it's a mild irritant, quote unquote. That's what they say in the studies. And it's like, okay, well, mild irritant for someone completely normal and perfectly healthy might be okay. But then add, 5 makeup products that people use, and then, pollution every day, and the fact that they're eating bad food onto mild irritant. Mild irritant is now extreme irritant. So it's just, yeah, I mean, that is something definitely to take into consideration.
And yeah, I think like just like the example of people coming from Okinawa and within one generation, becoming unhealthy, we're seeing the same thing actually in the unhealthy like countries of the world, that within one generation they've become like multiples more unhealthy, right? Like, the unhealthy, you know, members of the society are, multiplying at a dramatic rate. So like autism rates are skyrocketing, rates of all chronic disease are skyrocketing in the societies that were unhealthy to begin with, right? In the last, 50, 60 years, right? Like we've been a very unhealthy nation in the US for a long time, but we are every like passing generation getting far more unhealthy, right? Like the rates of chronic disease are just like exploding, and it's the same thing, right? Like you can't explain that based on just genetics. I mean, you could we could talk about epigenetics and how like the resilience of populations may be declining over time. So that's one issue, but that the resilience, the epigenetic resilience is linked to the environment. I mean, what is it that destroys that epigenetic resilience in populations over time? Is those are environmental factors. But maybe just to like mention like what I'm talking, like what is epigenetics and like how does it like the example, some examples. I mean, I think you might know more about this, but I remember reading in Weston Price's book. He was a dentist who traveled the world like 100 years ago, and he was studying traditional cultures and then like side by side with members of those cultures who had moved to the big city. So like a lot of times he would actually do like a twin study. He would have a twin who stayed back in the village living like, the traditional lifestyle. And then another twin went to the big city and like, got a job as a food scientist or a programmer or something, or a banker or a doctor or a lawyer. And he would show how their health, had changed, over time. And obviously in an identical twin, everything is the same, except for your environment. So the environment is what's different. And he would find chronic disease in the people in the city, and health in the people in the countryside, or maybe like an infectious disease or something, right? So this brings up that comment one of our patients had to you, that like, why are you talking about ancestral health, right? Like, why are you an ancestral health coach, right? Like, didn't our ancestors like live, nasty, brutish, short lives? Like, didn't they die in their 30s and 40s? And it's like, maybe we should address that too, right? Like, I mean, from my point of view, it's like, yeah, I mean, if you die from like a cut that gets infected before the age of penicillin, I mean, that's like a different story than if you live into your like 80s, but the last 20 years of your life you're in a nursing home and able to take care of yourself, right? Like we're able to keep people alive, right? But I remember when I was in residency, we had a lot of people who were like, they were like severely demented, right? And basically unable to, like you would almost say that this person must be brain dead. Like there's no reaction at all, and yet they survived for years, right? They would keep coming back to the hospital with this infection, that infection. The nursing home would keep sending them to us, and we would clear up their UTI or whatever, or their pneumonia, and send them back. And then a few weeks later, a few months later, they would come back with something else, and then they would go back. But like this entire time, they were like just kind of like in bed, like not moving, not talking, not thinking, no reaction at all. So Western medicine has been able to like keep people alive far beyond where their ancestors would have died, right? So like that person's, ancient ancestors probably would have, passed away a lot sooner from a war, or from, natural disaster, or from famine, or from infection, right? If they didn't have like a robust kind of like traditional herbal, healthcare system in place already. So there are a lot of things that ended up killing people back then. But maybe I'll let you kind of like
Yeah.
reflect on that for a moment.
Yeah, there's a lot of threads. Yeah, I think one way in which Western medicine has really advanced is in emergency services. So, if you get hit by a bus or you have a crazy accident, it's great. We've improved a lot on that aspect. The speed at which they can get you and do surgeries to reconstruct and all of that has been an amazing advancement in science. But, when it comes to chronic conditions, it's just there in the data. I mean, every single year, as you say, there's more chronic lifestyle conditions. So okay, people are living longer, but what is their quality of life? And as you said, during our ancestral times, there would be many reasons why people would die that don't exist now, like infections, or even, I mean, if anyone has read the Sapiens book, that some ancient cultures even had traditions of killing old people, especially the nomadic tribes, because if you can't move around, you'll kind of slow down everyone. So they would actually just surprise kill them, which seems unfathomable to us, but it's just, yeah, it wasn't, if you were weak and sick, it's just you couldn't be part of the community anymore. And yeah, now we really prioritize keeping people alive over and above everything else. So just to look at life expectancy, doesn't really make sense. And I think also just in terms of, our physiology hasn't really changed that much. So to say that, okay, now we're adapted to all of, the rate of change in our lifestyle and in our diet and what we're exposed to is much bigger than the rate of our physiological change. So there's just an incompatibility there. Like we're not that different to our ancestors comparatively to how differently we live. So then there's that disconnect happening.
Yeah, exactly. So I think we're gonna wrap it up here, and I think one of the topics we'll talk about next time is ancestral health, right? Because versus, for example, so for example, how do you determine what a healthy lifestyle is, right? Like, is there like an evolutionary template that we can look at? Can we look at our ancestors and be like, okay, they were really kind of finely in tune with their environment, and they evolved in certain environments, and they evolved to like eat certain things and sleep in a certain way, and have a certain amount of activity and stuff like that. Can we use that as a template for a healthy lifestyle, or should we study a healthy lifestyle, and like try to like look at sociological research on healthy lifestyles and healthy diets, and where the drawbacks might be to looking at research studies, and why they may be misleading us in some sense in some cases. So next time, hopefully we'll focus on that, and maybe bring in some other topics as well. So again, thank you everyone for watching, and thanks Michelle for
thank you
being here, and we will be back next time. Hey, so I'm actually going to be able to answer some live Q&A questions, and I apologize in advance for the noise. I mean, this person just started trimming the grass right in front of my office, so hopefully you guys can hear me okay. All right, so unfortunately Michelle wasn't able to join for the live Q&A, but I'll go ahead and answer the questions that we got. So Vic was asking, I eat healthy, do intermittent fasting, try to do Wim Hof breathing, not cold exposure yet, but because of injury, can't exercise as usual for about 2 months. What can I do to compensate for this layoff from exercise, like resveratrol, other things? In order to promote, and I skipped the first couple clauses of the question, basically to promote autophagy and boost my immune system, I eat healthy, do intermittent fasting. So what else can I do to promote autophagy and boost the immune system? So certainly supplements are great. So resveratrol, curcumin, black seed, there's a lot of supplements that trigger autophagy or help to trigger it. Longer, just about fasting, longer fasts are important for the deepest levels of autophagy. So 20 plus hours. Tom Bunker recommends up to 36 hours once a week. It's not something you want to do all the time, but once a week, if you have a longer water fast, I think that's that's great for triggering autophagy. And the other thing that's really important is really good deep sleep. So you got to figure out whether you're getting
proper, good quality deep sleep or not. So it's got to be really deep, restful sleep. That's especially important for neural autophagy. The other thing that can help in terms of diet, aside from intermittent fasting, is a ketogenic diet. So getting into ketogenesis, a keto diet will also help trigger autophagy. So low carb, carnivore, however you want to get into keto. But if you're aiming for that, you might as well make sure that you're in ketogenesis. Get some urine strips to check for urinary ketones, and make sure you're not just suffering for nothing if you love your carbs. So those are the main things. Certainly, cold exposure is a big one for boosting the immune system. I would definitely add that. Um, I went so far as to buy a chest freezer. I filled it up 3/4 of the way with water. There's all these different kind of DIY ways of keeping it clean instead of having to like refill it every day. And so there's like it goes from simple to more complex. But that's one thing. If you live in a cold place, you can just do cold showers. You got to have like really cold water. Um, and so those are the ways people usually do it. So yeah, I think those are all really great methods. Um, there's some other breathing exercises you might want to add, but the Wim Hof breathing is, 10 minutes a day is a great one to start with. And other kinds of like meditative movement are also really important for the immune system as well. So I would add something like whatever speaks to you, whatever you like, either, something like yoga, Tai Chi, Qigong, one of those things. I mean, I personally find yoga very enjoyable, but Qigong, I also like it. Just it's like, seems a little bit easier, more accessible. You can learn some of the exercises really easily. They're easy to do. A lot of yoga gets a little bit more complicated. So anyway, got to move on. So Kyle asks, through research online, I've seen a lot of doctors talking about mitochondria and good bacteria having to be in your gut to heal. So mitochondrial health, I guess, and good bacteria in the gut. So mitochondria are very similar to bacteria. I think maybe that's why you're lumping them together. One of the evolutionary, lines of reasoning is that maybe our eukaryotic cells engulfed a bacteria, and then they kind of developed a symbiotic relationship with that bacteria, which turned into the energy production kind of factories of our cells, and now we call them mitochondria. Anyway, they have separate bacteria. They have separate DNA lines. Our mitochondria versus the rest of our DNA. So there's separate mitochondrial DNA, which is passed down from mother to child, and that was one of the ways that they figured out the mitochondrial Eve lived in somewhere in Africa. So anyway, I know that prednisone is on FLCCC and read where it depletes your good bacteria. So I guess the question would be, does it also harm your mitochondria? And as well as your good bacteria. And obviously, good bacteria are important for our general health. And what's found in the gut is also actually reflected in the brain. There's this whole blood-brain barrier thing is, I think, overblown. It's not as much of a barrier as we always thought it was. So a lot of the bacteria that are found in our gut are also actually in our brain, right? Which is shocking to a lot of people because they think of bacteria as something dirty. But the kinds of bacteria that you have in your gut will be found in your brain as well. And so it is important to keep an eye on what you're taking in and how it's affecting the good bacteria and possibly your mitochondria. So yeah, prednisone is one of the things, and there's a lot of prescription drugs that affect healthy bacteria. Steroids, things that lower like acid production, like Prilosec, PPIs or proton pump inhibitors that people take for reflux and stomach ulcers, antibiotics, obviously. So there's a lot of different things that affect healthy bacteria. And there's a lot of things that probably do affect healthy bacteria and we don't know it. So ivermectin is actually one of the things that probably has some effect on good bacteria. We just haven't really looked at that in a lot of detail, but it does have weak antibiotic effects. So it's certainly going to affect bacteria in our gut when we take ivermectin. COVID itself, probably most infections will affect our healthy gut bacteria. The best way for us to affect our healthy gut bacteria, the the way to control what's in there is by what you eat. So if you eat all meat, you're going to have a certain kind of bacterial population in your gut. If you eat all vegetables, you'll have a different one. So different things feed different populations of bacteria. So part of what you're eating is also feeding what's inside you, not just your own kind of quote unquote human cells, but also the bacterial cells. So anyway, to kind of get to the point of your question, the prednisone on the FLCCC, maybe it has some weak effect, but it's a very low dose of prednisone. It is being extended for a few weeks at a time, probably, and so there's always going to be this balance between risks and benefits, and harms versus benefits. So unfortunately, there's nothing that's purely beneficial that we know of, outside of perhaps lifestyle, and even that can be taken to extreme. But in terms of supplements and especially prescription drugs, you're always going to have to balance risks and benefits, which is why I generally recommend, like in my mind, ivermectin is probably the least risky, right? It has the most benefits, but like I said earlier, like just a few minutes ago, that it does also probably affect healthy bacteria. We just haven't really enumerated in detail that effect, how much of an effect it is, and whether it's like skews them in a good way or a bad way. I mean, we don't know. Ideally, ivermectin would boost good bacteria and diminish bad bacteria, but we really don't know the answer to that question. And so going from ivermectin to low-dose naltrexone, prednisone, all of these things are going to have some effect on our body, some side effects, and some of them are going to affect good bacteria. But that's just like one variable to keep in mind, to weigh against the possible benefit. And but there's always this risk-benefit kind of way of thinking in medicine. All right, so Christine says, COVID made my Hashimoto's incredibly worse, and now I have widespread inflammation through my body for a year now, post-COVID. Still have 1400 level COVID antibodies. I eat healthy, do all the lifestyle changes, not sure what else to do. Also viral reactivation, including Epstein-Barr, HPV, etc. The best kind of there's a bunch of functional medicine kind of lifestyle protocols for Hashimoto's. One of the good ones I've mentioned before is thyroidpharmacist.com. Isabella Wentz, she's published a couple of books, really great ones on how to treat Hashimoto's with herbs and supplements and lifestyle, and diet. So there's really a lot in there, and there's you can help manage it by checking certain things, doing certain tests, but it can get quite complicated. It's very helpful to have a functional medicine physician or clinician help guide you through the kind of minefield of different issues with Hashimoto's and around Hashimoto's. So I'm not sure if you really are doing everything in terms of lifestyle, but if you are, then you at some point for most of these issues you have to start to self-experiment, and again, like a functional medicine practitioner can help guide you along the self-experimentation path. Maybe we just need to treat your long COVID, and then everything else will kind of balance itself out again. But maybe you need to treat COVID plus Hashimoto's plus reactivated Epstein-Barr. Maybe you need some antiviral for the Epstein-Barr and the HPV and all these other things to help suppress those again. So there is a way out. There may be a combination of just patience, time, and treating all the different kind of aspects here that are going on with you. But this is something that's very common. So long COVID and worsening Hashimoto's, very common. I hear about it a lot. It happens a lot. And I think I certainly believe that you can get it back under control. So whether or not you can do it with only the right lifestyle changes, that's a question. Maybe I'm sure we can speed things up with the right supplements and herbs, and possibly prescription drugs and medications, and targeted testing and treatment. And again, we are hopefully going to get Dr. Jackie, who is a functional medicine specialist, to be working with our patients with a functional medicine approach in terms of labs and recommendations and stuff shortly. So hopefully in the next week or two, she should be coming on board. All right, so Stephanie says, I had a pacemaker placed on June 1st and felt much better. Then in mid-July, I got COVID for a second time. I did the protocol, but for the last 3 months, I've felt terrible and seem to have more issues with my heart now. Could COVID have affected the function of my pacemaker? That's an interesting question. I suppose it's yeah. I mean, the first thing I would say is I don't think like the actual pacemaker itself would be affected in any way by COVID. But then with the pacemaker, you have these wires that go, into the heart, and the heart could have been affected by COVID. So the wires may not be conducting the message of the pacemaker as well. I guess that's a theoretical possibility. Um, so there may have been some, changes to the conduction system of your heart due to COVID, and due to like microvascular disease or, microclotting or whatever, could have changed some of the structure or function of your cardiac conduction system that the pacemaker was feeding into. So yeah, not the pacemaker itself, but yeah, the function of the pacemaker. It's possible. But the problem is in your heart. It's not in the pacemaker itself. But the leads may be, I guess theoretically they could be like in the wrong place now because something has changed in your heart. Um, and so you might want to revisit the whole pacemaker thing. Have another pacemaker study. I don't know if the cardiologist would be ready to do that, but that's one avenue you can take. The other avenue is just treat long COVID, right? And hopefully you'll get better. So so you said you did the protocol for the last 3 months. So I'm planning on filming kind of a video. What is my protocol, right? People say they did my protocol, but I don't think I've ever taken anyone to the very end of the protocol, right? So um, I've I don't think I can think of a single patient that stuck with me long enough. Either they got better or they gave up and didn't come back and ask me what's the next step. But like the protocol, the first couple of 2-3 months is like adding prescription drugs one by one to the lifestyle and the supplements and everything and the herbs. But then if you're still not better, you have to come back and have a follow up visit, and then we might go to Maraviroc, or we might go to blood thinners, aspirin, Plavix, Eliquis, or we might try something else, right? We might, unfortunately, some people, if you tried everything, if you tried the Maraviroc approach, you tried the blood thinner approach, full strength, all three blood thinners, right? Not a lot of my patients have done all those, um, and all the meds, right, in the protocol, and there's other meds that I don't commonly prescribe. They're not like in the main protocol that I prescribe. So anyway, um, come back, have a follow up visit, and we will, reassess what you've done and whether there is like a next step to the protocol that you have not yet tried, that you should try. A lot of people, I mean, we just started doing all these lab tests recently. Probably in the last month, maybe a month and a half. So a lot of patients. So if you started 3 months ago, you may not have done all the lab testing that we're recommending. So there are probably things that we can add to your protocol or change, and hopefully get you better. And there's a really big focus now on treating sympathetic nervous system overactivation, which I think is very important for any heart problems, that might be related to a pacemaker issue. So palpitations or irregular heartbeats and all this stuff. This is probably a lot of it has to do with microclotting. So maybe you're not on the serrapeptase nattokinase or lumbrokinase serrapeptase approach. That is important. You may need to start that for microclotting in the heart, but you also may need to address sympathetic overactivation feeding into your heart and causing problems with your heart cardiac conduction system. So, the breathing exercises, cold exposure, sauna, vagal nerve stimulator, possibly stellate ganglion block, that whole kind of set of interventions I haven't really been talking a lot about until the last month or so. Lonnie says, maybe you've already addressed this, but I'd like to hear your thoughts on ivermectin. Is it indicated for post-COVID inflammatory issues? Yeah, so post-COVID inflammatory issues, I would call them long COVID, or some people call them post-acute COVID syndrome. Some people call it post-acute sequelae of COVID. So it's basically long haul or long COVID. And yes, absolutely, I use ivermectin a lot in patients. That's kind of like the first prescription that I would try because it's so safe, and there's so few downsides. There's so little risk. It should really be available over the counter everywhere in the world. I mean, it's available over the counter in much of the world, and I think at least one U.S. state it might be over the counter now, based on some recent legislation. But in most U.S. states, most of the country, you have to get a prescription for it. But definitely, I would try it for post-COVID inflammation. It has anti-inflammatory effects. It decreases some of the cytokines, the interleukins, nuclear factor kappa beta that are elevated in a lot of COVID long haulers. So definitely, it's worth a shot for most people, unless there's some kind of contraindication. Chris says, do you think that those with long COVID but not vaccinated are at risk for autoimmune disease and cancer? This is concerning to me and to me as well. So I think this is a big concern, and it's it's a question mark. There are studies that have shown that people who have had COVID have a higher risk of brain disease, and some people are reporting increased rates of a number of chronic diseases. So, and increased levels of autoantibodies and perhaps autoimmune disease. So I'm not, the data or the studies are kind of like the way they've been set up is kind of convoluted, and it's kind of hard to tell whether it's really good quality. And there's all these like caveats to the studies, and, limitations in the limitation section. It's like, well, this is, it wasn't, the study's not perfect essentially. So at the end of the day, it's almost like people have a religious belief about this. It's like, well, COVID is just a virus, it's probably like every other virus. And I honestly, at the end of the day, I don't know whether, and it's because we haven't had the really good quality studies. You got to control for vaccination in the study. Ideally, to set up the study properly, and I mentioned this in the Facebook group, and I think in a message that I replied to somebody, and this was in the last Q&A or a couple of Q&As ago, where somebody had asked me essentially the same question. Have I seen good quality studies? And I went and looked at a couple after that Q&A, and the way you would want to set it up is you would want to be as sure as possible that the control group had never had COVID, right? Like you would want to, instead of just like looking at like records and diagnoses and diagnosis codes and stuff, you would want to be sure that this group had had COVID and this other group had not had COVID, right? So how would you know? Like not just like the acute test, but also you would check antibodies in both groups, and you would exclude people, who had never had a COVID diagnosis or illness, but who had developed COVID antibodies. You would say, well, this person obviously was exposed and they had COVID, even if they had no symptoms, and that wouldn't, and so your non-COVID group would, you would be as sure as possible that they had never had COVID because they had never developed antibodies. And I'm not aware of a study that's been done to that extent, a very good quality study. And so we have a lack of good quality data, unfortunately. And so I don't know. I think it's certainly theoretically possible that long haulers. I've seen some. The doctor I've spoken to in the past. I interviewed her, Maravik Villa, down in Florida. She has a practice in the villages in Florida, and she has a lot of data. She's able to run tests on a lot of her patients who have Medicare coverage, and the Medicare covers the tests. So she's seen hundreds of patients with both long COVID and vaccine injuries, and in the vaccine injury group who has like symptoms, right? They're like, these groups both have like long haul kind of symptoms. That's why they're coming to her. So they have a vaccine injury that's causing like symptoms that they need addressed, or they've had COVID and they have long COVID now. So both groups have like a long haul syndrome. Um, and in the vaccine group, who has symptoms of like long haul, about 30% of them have evidence of immune suppression, lower immunoglobulin levels, and lower CD4, CD8 T cell counts, like sometimes to the point of like what we would call vaccine acquired immunodeficiency, like vaccine AIDS, which is just shocking to me because never before, I've never seen low CD4, CD8 T cell counts in any condition other than AIDS, HIV AIDS. So we're seeing it in the vaccine in about 30% of those who have long haul syndrome. In the COVID group who have long COVID syndrome, if you look for the suppression, low immunoglobulin levels, low CD4, CD8, it's about 15%. So half as much as in the vaccine group. So it seems that both groups are having a suppressed immune system, almost kind of like a AIDS type of syndrome, acquired immunodeficiency. And if you have acquired immunodeficiency, that can turn into cancer, right? So one of the, some of the AIDS-defining illnesses are cancers, right? Leukemias and such. And why is that? The immune system is required to suppress cancer cells, right? Everyone has cancer cells, microscopic little, cells that become cancerous, and then your immune system kills them off before they turn into an actual, large cancer that you can see. And the same with autoimmune disease. If you have immune dysfunction of some kind, you're at higher risk of autoimmune disease. So unfortunately, I think that the problem is going to be, seen in long COVID patients and in those who have been vaccinated. But perhaps, the vaccinated may be worse off than those with long COVID. In my own practice, I mean, just what I see is mostly people who have long COVID and much fewer people who have vaccine injuries. That's just a quirk of my practice for whatever reason. And I think one of the reasons is that people, who were not vaccinated, right? Like most of the, some of the people who think they have long COVID actually were vaccinated, so it could be a vaccine injury. But primarily, it's people who weren't vaccinated, right? And they were more likely to kind of be aware of long COVID as a diagnosis and more likely to be aware of ivermectin and off-label treatments, and so that's why I think our patient population skews in that direction. Is just they were ready to hear, they're ready to diagnose it themselves, and they know who to come to help them. Whereas those who've been vaccinated, most of them who have been injured, I think the vast majority, they're stuck in this medical system that's not, that keeps telling them there's nothing wrong with you. It's just like all in your head, or, you've developed an illness that would have developed no matter what. It's just coincidental that it's related, time related to the vaccine. Um, you know, and so for a number of different reasons, those who have vaccine injuries are not showing up in my practice and in other practices. They just haven't gotten around to understanding what's happened to them, unfortunately. But yeah, to answer your question, I think that it will be a problem for long haulers, but how much of a problem, we don't know. So like I said before, in that, patient population of Maravik Villas, 15% of the people who have long haul syndrome after COVID are seeing signs of immunodeficiency. But that's not like 15% of everyone who's had COVID in her practice, right? So it might be closer to 1% or 1.5. I mean, who knows, right? Like it may be just slightly elevated risk of autoimmune disease, cancer in the entire population of the world who had COVID. Even if it was like 50% increased risk of like cancer, if the baseline risk of cancer in the population is 0.1%, you go up to 0.15%, right? So if you have a 50% increase. So it's not as bad as it sometimes sounds when you talk about the absolute numbers, right? Like if there was a 50% rise in cancer rates or autoimmune disease, or a doubling of autoimmune disease and cancer in the whole population, who've had COVID, it may not be quite as bad as you're imagining, right? I think the vast majority of people who had COVID will probably be fine, but there is always this risk that we need to study, and unfortunately, we have not spent the dollars and the time to study it. We just have not done it properly yet. So unfortunately, we don't really know. So I think it will elevate risk for these things, but how bad that will be overall for the world at large is it's a big unknown at this point. It's also an unknown for people who've been vaccinated, right? I mean, there's commentators who are like, warning that everyone who's been vaxxed will die. I don't know. I mean, that would be like, I can't imagine living in a world where everyone who got vaccinated died. I mean, that would be really terrible. Like Armageddon kind of situation. I mean, it's hard to imagine that that's going to be the case. Predictions, both sides, extreme predictions are oftentimes wrong, even though they, the extreme predictions for the number of COVID, infections and deaths were way off, right, from the Imperial College of London. And at the same time, the extreme predictions of people who worry about the effects of the vaccine may also be off, right, by many orders of magnitude. So let's hope that they are. I don't know. I mean, time will tell. Which reminds me that I'm going to be interviewing Gert Vandenbosch. I think the first Saturday of November. It's going to be streamed on CHD, or Children's Health Defense. An interview with Gert Vandenbosch to talk about his prediction of a super virus developing this winter perhaps, and especially for those who have been vaccinated. really, I mean, he's basically saying get some ivermectin and you'll be fine. It's basically like a call to people to get your meds, put them in your medicine cabinet, be ready to go, especially if you've been vaccinated, but also even if you haven't. The virus may take a turn for the worse, become more severe. And due to evolutionary pressures from the vaccinal antibodies. Ivan says stellate ganglion block shot, it can reset the nervous system. Yes, I'm not sure if there's a question here. It didn't get through to me. That's what it seems like, right? So in the long COVID reset summit, it's streaming free November 18th to 20th. So next month, everyone should go register and let everyone know about it. Longcovidreset.com. I'm gonna interview. I'm interviewing Dr. Groisman, I think his name is, from Dallas, Texas, about the stellate ganglion block that he's doing. Tremendous results. I can tell you from talking to him. I mean, like 95 to 100% efficacy for a lot of very common long COVID symptoms. And it really drove home the point for me how important it is to address sympathetic nervous system overdrive. So it's not just resetting the entire nervous system, it's resetting the sympathetic overdrive that's happening in long haulers. So the sympathetic and parasympathetic nervous system are kind of like two arms of the autonomic nervous system, which is kind of that part of your nervous system that you don't have conscious control over. So it's what controls the beating of your heart and the function of your digestive system and whatnot. And so the sympathetic arm of that autonomic nervous system is in overdrive in long haulers. And so different ways you can reset that yourself include breathing exercises, cold exposure, sauna, vagal nerve stimulators, meditative movement, meditation. The meditative movements like Tai Chi yoga, Qigong, those are all very important. And talking to Dr. Groisman helped me kind of realize how important they are, and how they should really have a place of importance in any protocol for long COVID, because the stellate ganglion, there are other sympathetic ganglion going down through your body, and we're only targeting the stellate ganglion, so it's controlling some head and neck area symptoms. And if there are, it doesn't get rid of all the symptoms, right? So for the other symptoms that we're not you know able to target the ganglion and block it, if they're happening lower down, maybe a ganglion that's lower down in your chest that's affecting your heart and your lungs, may not be affected by the stellate ganglion. So even so knowing that the stellate ganglion or a sympathetic ganglion block can affect symptoms that are in the area of that ganglion, right? Just highlights the extreme importance of modulating the sympathetic nervous system in general through other ways for people who have symptoms in other locations, right, that you can't target with the stellate ganglion block. And so you definitely need to focus on these kind of traditional modalities: breathing, meditation, meditative movement, and things like cold exposure and sauna, and then also more of a futuristic tech kind of approach is the using a TENS unit, TENS, in order to modulate the functioning of your vagal nerve, which will help to balance out the sympathetic nervous system. And for people who are interested in all of that, you can take a look at Dr. Groisman. His website is reliefbeginshere.com. He has a free ebook about the block and also about the TENS unit, how it would be used. It's a $50 device. You don't want to overdo it. You can overdo it and like overstimulate your vagus nerve, so you don't want to do it longer than it should be done. So he tells you like the power, the setting it needs to be on the TENS unit, and how long to do it, and where to apply it. All right, so PJ says, your thoughts on colloidal silver helped save my life. Are you still recommending using a compounding pharmacy for ivermectin? CVS filled my first script from you in Michigan. All right, so yeah, so we don't use CVS anymore for ivermectin because pharmacists reported us, and there's just there's still, I think, a problem. A lot of pharmacists have a problem prescribing it or dispensing it. I'm writing a prescription and not dispensing it. So we just decided not to use CVS, and we ask all of our patients not to transfer prescriptions from the compounding pharmacy to a local pharmacy. If you're sure that a local pharmacy will do it, let us call them, make sure that all the pharmacists there are on board with it. They're not going to report me and make trouble for my license in front of the medical board. So we use a number of compounding pharmacies that have the cheapest supply of ivermectin. But if there is a local pharmacy that will that maybe a local compounder or another local pharmacy that has told you verbally that they don't mind filling it for you, we'll call them ourselves and just confirm that there's no other pharmacists there who might have a problem, who might, your pharmacist might be on vacation or off for the night or off for the weekend and somebody else comes in. And so we just got to make sure everyone there is on board. As for the colloidal silver, I don't have a lot of experience with it myself. I mean, obviously silver is has antibiotic effects and a lot of people use it. And it's been used historically. And so I'm sure that it's beneficial, but I don't personally know a whole lot about it. And whether or not it's been helpful for people with long COVID. I'd love to hear if you benefited from it specifically with long COVID or just with some chronic health issue. But I certainly see that there's there's a mechanism for why it would be helpful, certainly. All right. Nanette says, I have prosmia dysgeusia. I actually forget how to pronounce this. Dysgeusia. I forget how to pronounce it. But I think it's altered taste, right? And I've been working with an acupuncturist and other practitioners to try to overcome this sooner. It's been almost 17 months at this point. I take a ton of supplements, but my diet is the problem. Keto is not an option as I can't eat eggs, chicken, and meat. I can't eat onions either. Most of the things I can eat are carbs and sugar. Any advice on how to incorporate foods that are a little less carby? So there's a lot of there's a lot of unknowns here in your question. There's a lot of context that I'm not sure about. So you're telling me that you can't eat certain things. Is that because if you eat those things, you have a severe reaction, like an immune response? Or is it because somebody ran a test and told you that you're allergic to eggs, chicken, meat, and onions? If it's the latter, if you took a test and somebody just marked these things in red and said that you're allergic to them, so you should avoid them, those tests are very inaccurate. And really, the only way to be sure that that you can't eat something is to eat it and check and see. um, so yeah, I mean, it would be very unusual if you can't eat any sources of protein at all. And but yeah, so that I would have to know that or not, whether or not that's the case. But either way, even if you can't find something to eat that can get into ketosis, you can still do fasting. I mean, anyone can fast. If the only thing, like theoretically speaking, if the only things you could safely eat were carbs and sugar, you could still fast and it would still benefit you. So you would just eat whatever you're able to eat and then fast at the same time. So honestly I think that like what you eat is way less important than how much you eat. And I've had this experience in my own life. I went into like a very, very low calorie diet, and found that my health was like immensely better. I mean, I lost a lot of weight. Obviously you're going to lose weight, but I think a lot of people think that they're at a healthy weight, and they're not really at a healthy weight. So there's a lot of people who look pretty thin. They're not the obese, overweight looking diabetics. And then when you make when they lose 5 to 10% of their body weight, and it's like weight that's around their internal organs, it may not really be on the surface. It may look like they're not really overweight, but if they lose 5 to 10% of their body weight, their diabetes goes away. So a lot of people are probably above their ideal weight, right? Way above it in the US, I can tell you. And the one thing that is probably the strongest has the strongest effect on your health is probably just eating less. And sometimes it's like you got to eat dramatically less. There's a lot of different ways of doing it that make it much easier. You don't want to do it suddenly. You want to do it very gradually. So like the thing that works for me is essentially eating very small bites, and chewing them fully and not reaching for the next bite until you finish the last bite. So that really slows you down a lot because you got to just empty your mouth completely before you reach for the next bite and put it in your mouth. Usually people will just be like shoveling food in their mouth and they haven't fully, swallowed the last bite before the next one goes in. And then stopping before you want to. So, certain traditional cultures would say stop when you're 70% full or 80% full or whatever. But basically, if you just stop before you're completely full, right? You eat very slowly, very small bites, and stop before, while you still want to take another bite, at least. Your stomach will gradually shrink, and eventually you'll lose a lot of weight. Um, and you'll see a lot of positive changes to your health. So that's one thing: eating less, losing weight, but also fasting itself is beneficial. So intermittent fasting, maybe you keep your eating window within 1 to 8 hours, somewhere in there, right? So you can eat one meal a day, you can eat 2 meals a day, but try to cram them into no more than 6 to 8 hours, and you can get it down to even one pretty comfortably. Um, but whatever the daily thing, whatever you can do comfortably, maybe you eat 2 meals, within 8 hours. Best would be breakfast, lunch, but you can also do lunch, dinner, and then once a week of a longer fast, maybe a water fast, where you go for maybe 20 hours or 24 hours or 36 hours, however you want to do it. So the fasting is really quite beneficial and doesn't really matter what you eat. You can still get a lot of benefits from fasting and just eating less in general. Um, PJ, are infrequent sleep aids good to get a really deep good night's sleep? No. Yeah, Zolpidem, Ambien, like sleep aids, they kind of knock you out. They don't give you healthy, refreshing sleep. So they don't give you a good sleep, that's healing and refreshing, but they do put you to sleep. So they might be better than no sleep, but they're not as good as really good sleep, unfortunately. So, um, and I mean, personally, I would lean towards the side of just not using them. Maybe you might use like melatonin once in a while, but you really got to like dial in your sleep, and it's really you got to make some sacrifices for it, right? There's no two ways about it. Missing a good night's sleep once in a while is not a big deal, right? You go into a little bit of sleep debt, you pay it back over the course of a week, or so you sleep a little bit longer every day until you're kind of paid back that sleep debt, and then you just go back to your life. So infrequently, I would, if you can't function the next day without using it, you got to do what you got to do, right? But try to design a life where you don't need to use them, and where you are, disciplined enough to go to sleep at the same time every night. That's really the most important thing. Set a bedtime and stick to it. That's it. Um, and then and also, if you have to wake up at a certain time, give yourself that bedtime should be early enough that you get enough sleep before you have to wake up. But the most important thing is just to have a bedtime, and after a few weeks your body will just get adjusted to the point where you can just like fall asleep really fast because you always fall asleep at the same time every day. I think it's important to have a meal times also, because it just optimizes digestion, so it optimizes the functioning of that thing that you're setting a timing for. So when you set a time, your body gets ready to do the thing at that time, so everything is optimized, and it works really well if you have a set time to do it. John, have you tried nitric oxide for post-vaccine or long COVID? No. Yeah, I've started to hear about this lately. So if you have any experience or information, send it our way and we'll take a look. Let's see. PJ says, if I have to take omeprazole and it reduces my acid production and I have increased bacteria in my gut, um, are you saying it might be a cause why I have brain fog and can't shake it? What are the options? What to do? Yeah, so Chris Kresser, he's a functional medicine kind of guru. He has a website, chriskresser.com. That's CHRISKRESSER. He has some good ebooks, free ebooks on gut health and acid reflux and stuff like that, and how to fix it naturally, with dietary changes. And yeah, so omeprazole was FDA approved for like maximum, I think, 12 weeks of use, and after approval, people are on it for 12 years and longer, right? Instead of just the 12 weeks. So it does, change the populations of healthy gut bacteria, which may certainly affect brain functioning, and it's possible that your brain fog is linked to that. I can't say for sure how much of a contributor that is to your particular brain fog. There could be a lot of other things, right? So there's not going to be a one-to-one correlation, because brain fog is one of those multifactorial problems where it's like it could be 100 different things feeding into brain fog. One little leg of that 100-leg stool might be, the gut bacterial issue and the omeprazole that you're taking, but it might be a minor, leg, and it might not be a major leg, and I don't know. So just fixing that one thing may not get rid of your brain fog. Just like, we were talking with Michelle about the Dale Bredeson's protocol. There's like dozens, literally dozens of factors in his protocol, that he addresses for, pre-dementia, aka brain fog. Not saying that all brain fog is pre-dementia, but there's a lot of overlap in the symptomatology between pre-dementia and people who have brain fog. So there is a solution here to acid. So it's not really, acid's not the problem. You have to have acid in your stomach to digest your food. When you take omeprazole and you cut your acid levels really low, you're actually just not digesting your food very well. But the reflux, that usually has acid in it, is not causing pain in your esophagus, and so you need acid. And sometimes actually the solution to acid reflux, and I'm not sure if you have acid reflux or if you have stomach ulcers or what your issue is particularly, but if it were acid reflux, not a stomach ulcer, then sometimes taking acid supplements like betaine hydrochloride actually gets rid of your reflux. And it's like there's this one-way valve in your between your esophagus and your stomach, so that you swallow, food goes into this tube called the esophagus, and then it passes through a one-way valve into your stomach. And so one-way valve means the food is supposed to go through your esophagus into your stomach, but it's not supposed to come back up, right? This valve gets a little bit weaker when there's less acid in your stomach. And then you can have reflux. If you increase the acid production in the stomach, that valve closes really tightly, and you may not have reflux. So sometimes the solution to reflux is counterintuitively actually increasing the acid in your stomach to make that valve shut really tight, so that the acid doesn't flow back up into your esophagus like it's not supposed to. What's in your stomach is not supposed to squirt back up into your esophagus and cause pain. So if it's not working as a one-way valve, then part of the problem might be lower acid production, which happens as we grow older. Some people, their acid production decreases, and taking an acid supplement actually helps. So you got to go very slowly if you're trying that out. And an acid supplement would probably not be a good idea if you have a peptic ulcer, like a stomach ulcer or esophageal, or like an ulcer in your stomach or in your duodenum, which is after the stomach. But if your problem is reflux going into your esophagus, then you may be able to find some benefit from adding acid supplements very carefully, and finding a dose that works for you. But it's oftentimes just diet. You're just eating the wrong things. You're eating things that don't agree with you, that lead to reflux of acid, or that lead to stomach ulcers. And for some people, it may be H. pylori, infection causing stomach ulcers. So it's a big topic, but there is a solution. You can take a look at Chris Kresser's free ebooks on that topic, and get probably 90% of the functional medicine approach to acid reflux from reading those free ebooks and trying some of the things he recommends in terms of changing your diet and trying different supplements. All right, so we're going to wrap it up here. Thanks, everyone. I just want to again plug the longcovidreset.com summit, November 18th to 20th. We're going to have a lot of amazing content, especially talking about some cutting edge things like the stellate ganglion block, and triple anticoagulation, and microclotting, and different approaches. I'm going to probably give a talk just kind of giving people like, what is my protocol right now, right? And the different kind of avenues we can go down for the protocol, and the different kind of like, if this doesn't work, then what do we do next? Kind of like in a thinking of like how I'm approaching long COVID now, and all the different, FLCCC protocol supplements and herbs and dietary things and lifestyle changes and, prescription things that we're using. But then there's going to be a lot of people talking about, like Dr. Mubin Syed talking about autophagy, and people talking about nutrition and supplements and other lifestyle things, and mindset and motivation, a lot of other stuff. Really exciting. And you can sign up for free, or you can sign up as a VIP member. The VIP, signups will, I think it's just like $49 or something. For that, you get access to the recordings afterwards, and you also get access to the live Q&As with myself, Michelle, and some of the summit participants will be showing up for live Q&As, not all of them. But whichever ones do, you'll have access to all the live Q&As during the summit, and obviously the recordings afterwards. The people who are watching for free will have access to all the live streamed recordings during November 18th to 20th. After the summit, I think for a week we'll still offer the free access, and then after that you can upgrade to VIP if you want access to anything else, or longer access, or if you want to see the live Q&As that were recorded. All right, and also you can watch us on YouTube or Facebook. I have my own Facebook page. There's also the Long COVID Reset or Long Haul Reset Facebook group where you can watch this stuff that we're doing. Leading up to the summit, we're going to have me and Michelle, like we spoke today, we're going to have another 3 of these, similar topics over the next 3 Mondays. And wherever you're watching, please be sure to like and subscribe and share. We're also on Gab now, and we'll be posting this in Gab as well as Facebook, and probably putting it on Gab TV as well. All right, everyone, thank you so much for watching and listening, and for your questions and for your contributions. The Facebook group is awesome. It's amazing. You guys teach me a lot, so keep letting me know of the stuff that you find to be helpful for you, and keep telling us of things that we should look into, because a lot of these things, I mean, just like this regime that we're living under of social media control and government control and censorship leaves a lot of us at a loss, right? Like there's people who are at the cutting edge of long COVID treatment who have never heard of a lot of long COVID treatments, right? So like the stellate ganglion block, I think is a tremendously beneficial procedure that's really easy and it works really well. And I had never heard of it until like a couple of weeks ago. And I got it from the Long COVID Reset group. So, today somebody mentioned nitric oxide. Keep those kind of things coming, and share with us the data and the experiences you have on them. All right. Thanks, everyone. And we will see you next time. Wednesday, we're going to have another live Q&A. All right, everyone. Bye-bye.